Thanks for the introduction. Kristofer Bengtsson, Swedish Defense Research Agency. I have a background as a naval officer, and I'll be presenting some work that I did during my master thesis studies in political science, which started out with an internship here at the KMC, and later on the master's thesis for 6 months, according to that. So generally I spent more time here at the KMC than at campus during my 2-year studies. The studies conducted that I will be presenting today is 2 interview studies that were conducted in the spring of 2016 and 2017. The first one was tasked by the KMC, targeting the public healthcare services and then especially the county contingency coordinators. And out of 21 counties, we got a 23 interview result, which is good. The second one targeted the rescue services and the police. 8 members from the rescue services and 10 from the police, 41 in total. The aim was to provide a joint or a common view, like a snapshot of the perceptions in 2016 and 2017. Semi-structured interviews and a predefined targeting process. It took 60 to 90 days per study to collect the data, and the data was collected by phone mainly. During the studies, this definition was chosen in regard of the incident site. It's the place where professional actors organize themselves in order to handle the effects of an accident or an incident. Therefore, the incident site is established. Before the incident site is established, it is merely the place of an accident or an incident. I'll show you some of the results in the form of tables, and then I'll jump straight to the conclusions instead. Dominating terms and concepts when it comes to everyday incident sites mainly consists of traffic and fire-related incidents. Worth noticing here is the medical first response alarms, which is a bit grayed out, column number 5, where 50% of the rescue services address this matter. And this is, for those who doesn't know, firefighting teams that are tasked with aiding in a medical situation until relieved by a medical team. The worst case scenario today, according to all 3 branches really, is the dynamic extensive incident with a mass casualty event, especially if you apply threats or complexity to the situation. And apart from that, a large number of injured people without threats. And this is due to limitations in the system as a whole. The perception from the 41 interviewees was that in 15 years this will be the same, also due to limitations in our own system. The greatest challenge today is basically internal and external cooperation and communication. This has been addressed by several speakers before during the day. Also, a challenge is that there is somewhat of a lack of a joint or a national perspective, especially related to collaboration and means thereof. In 15 years, this has changed somewhat, and number 1 on the list is now acts of terror. You can also see that it's quite a complex array of replies, which makes it somewhat hard to analyze. But some conclusions can be done or made. The incident site as a whole will, according to the interviewees, develop as follows over the course of the following 5 to 15 years. Same as today, interesting to note, but with more technology involved. Also, there will be an increase in violence and social unrest according to the public healthcare services. This is not the perception from the police or the rescue services, which is a distinct difference. On the other hand, the police and rescue services point out that methodology and technology for command and control, direct actions on the incident site, will evolve due to technological advances, mainly, and also the increased complexity with threats, violence, technology, and toxic substances. For example, the cars that we heard about earlier. So, unchanged, yes, due to these perceptions, based on the fact that it will still mainly be about traffic and fire-related incidents, even though the complexity in the scene itself will evolve. The future incident side will likely continue to be concentrated to traffic and fire, as I said earlier. But also interesting to note, the potential loss of trust, which is addressed by the police and the rescue services, is perceived as something that's very, very worrying, as well as the risk for an increase in the use of violence. And the worst case scenario will continue to be a mass casualty incident with a complex situation. Other conclusions that can be made from these two studies, according to the perceptions of the interviewees, is mainly that the Swedish concept for response and control and command and control on the incident side works well when handling events that are limited in time, space, and magnitude, number of injured people, geographical area of dispersion, etc. Also, Sweden is sensitive, and we've heard this also during the day, in regard of disruptions. We are very, very dependent on IT and just-in-time deliveries. The compatibility, operational reliability, and backup procedures are therefore very, very important. And there's also a perceived need of centralized directions and management in a pre-incident perspective. This also constitutes the main challenges in handling the incident side of the future. Cooperation and coordination, joint and branch-wise. And this is due to cultural differences, but also differences that are within the system in itself, according to law and regulations. Perspectives. The pre-incident perspective, during and after. The pre-incident perspective, planning. During, coming together, the collaboration part. After action reviews, get together, get some good examples going, and then try to go do better next time together. Dynamic and complex situations due to technological advances and also events occurring in our environment, both climate and also security policy, etc. New threats means new methods, and this is where us, the science guys, come in, trying to help the guys and women in the field doing a better job to handle these kind of new threats that can be foreseen, possibly, but also to prepare for the unexpected. Resources are somewhat of a challenge, especially in regard of economy, personnel, and also space and tech materials. The dependency on IT and just-in-time deliveries, just to mention a few, is something that will be a challenge, and we'll need to address that as we go. Which brings us to the suggestions for future research. Analysis of existing laws and regulations, and this is in order to find where can we complement each other between the branches in the crisis management system. Other fields for future research that would be suggested is to make an evaluation of cooperation and coordination abilities on a national level, for example, using the National Board of Health and Welfare, their exercise TYKO that was set during 2016, and also Aurora 17, which we heard about earlier. And lastly, in the same line really, civilian defense and a crisis management system, the degree of compatibility between these two systems. Could they merge as one? Can we use abilities and personnel from one or another, or should they be separate? The latest report from the Swedish Defense Department says no, we should not. We should do that as one system. and this might strengthen the crisis management system in peacetime as well. So there are many challenges, and there's a lot of work underway, not to say least from CARE and also the Civil Contingencies Agency, the MSB. That's me, 10 minutes. Mark.